Everybody should always advocate for themselves. And most important thing that comes with establishing rapport, do you feel that the doctor in front of you is a person you can get to grow a relationship with and trust? Because nobody is able to solve all of your problems in one day. And don't be a pill seeker. That's very important. Be willing to do the work. Because at the end of the day, you're your healer. We're just instruments. We can give you some information. We can do testing. We can give you medical recommendations, but you're the one who's going to do the work.
Today, I have a very special guest for us. We are so lucky to have Dr. Annette Fornos. Dr. Fornos is a board-certified physician in internal medicine and functional medicine. She is one of our incredible practitioners here at the Institute of Neuro-Immune Medicine. And Dr. Fornos, I would just like to welcome you and thank you so much for spending time with me today.
Thank you, Haylie. It's really a good opportunity, and I'm really feel honored that you invited me today. So thank you so much.
We're going to have some fun and talk about some great topics. The purpose of the podcast, right, is to bring hope and help to individuals out there that are dealing with chronic fatigue, ME/CSF, Gulf War injury. And I want to just lean into you a little bit as one of the practitioners in our clinic and ask you questions about what you're seeing right now in the progression of our patient population. So let me start. I'm just going to launch really quick. You're not a physician that has ended her education after you started practicing. One thing that has inspired me is your passion for functional and integrative medicine. Can you give me a little bit of insight as to why you're doing that, why you're pursuing that, and why you have pursued that?
Functional medicine offers me the ability to learn and dig, and very importantly, dig deep into my patient's conditions and lifestyle, which was not possible when I was practicing traditional internal medicine, which I love, by the way, for many years. I always felt there was something else that I wanted to do, and to learn, first of all, and to be able to implement or, to my patient's conditions. So that's what inspired me in the first place. And you're right. I absolutely am studying every day. My kids, if they need an example of what to do, I'm always, almost every single day of my life studying. And it's because there's always something new to learn and implement.
Do you find that the patients bringing their own unique situations and conditions can be a motivation or a precipice for that?
Absolutely.
Yeah.
All the time. I've learned so much because my patients will bring me a new thing or a new test they had done or a new symptom that I don't necessarily know how to relate to their overall picture. And so the more that I get patients with similar conditions, I go back and I try to identify what am I missing? What else do I need to know? And that has, what brought me to learn things such as, or study things such as chronic inflammatory response syndrome, or CIRS, which looks so much into biotoxin illness and environmental illness.
I'm going to take a giant step back because I jumped right into the middle of it because I think I'm excited to ask you so many questions. Can you help all of us understand when we have a physician that's looking at things from an integrative or a functional medicine perspective? What does that even mean?
So it's a great question because I get asked that a lot by patients and people who haven't heard of functional medicine. And it's really root cause medicine. That is what it means. It's not nutraceutical medicine. It's not the opposite of traditional
or
medicine.
Alternative medicine.
Or alternative.
Right. So in functional medicine, you say we're looking at the root cause. Mm-hmm. So why the body has the symptom profile that they have, or why they can't get well, or both?
Absolutely both. So why can't people get well? What are we missing in the picture? Why are so many different conditions stemming from similar exposures or similar situations or things that happened previously in the patient's lifestyle? And the same way, why are the same exposures or the same conditions leading to different things, but why are different exposures or different conditions leading to the same pathology or the same illness?
So sometimes with your patients, then you'll look at the why, but we'll also have maybe a broader approach to how.
Absolutely.
Okay. Yes. Okay. So the approach is broader. The time spent. I'm going to ask you this: how long do you spend with a new patient?
So I spend an average 2 hours with a new patient.
Wow, that's amazing.
I spend all the way to 4 hours. For the majority of the time is from 2 to 3 hours with a new patient.
And specifically at the Institute for Neuro-Immune Medicine, we have a lot of complex patients, right? Absolutely. Can I ask you, do you see some commonality? So we talk a lot of times about maybe some of the neuroinflammatory disorders or chronic fatigue syndrome or Gulf War illness or even COVID long haulers presenting very similar.
Mm-hmm.
Do you see similar things that are of root cause? Is it infectious? Is it environmental? Is it all of the above? Is it the systems have gone awry? Give me a little bit of what we see.
I think you answered it. Yes, it's all of the above because we're an individual, we're an organism. We are affected by different things in our environment, both internal and external. Our genetics, from our genetics to before we were born, to what is going on in our everyday lives. So yes, you're absolutely right. Our patients, when you dig deeply, you realize that they have a lot of things in common. And we call that in functional medicine total body burden, because many times you have more of a predisposition, or you'll do worse when you, let's say, catch a viral infection such as COVID, if you have predisposing illnesses or risk factors that you weren't even unaware of, because you were able to cope with them to the best of your abilities until something else hit you. And now we're in trouble. So we see that very commonly every single day in our practice.
Do you feel strongly that this approach to medicine is important if a person's dealing with chronic disease? Is it difficult to unravel it? Have you seen in the past to unravel it without this kind of approach?
It is difficult. Well, without this kind of approach, there's no unraveling. It's not part of the concept, right?
Right.
We're not even practicing traditional medicine for so long, a patient came in with fatigue and the differential diagnosis was quite short. And it's a very quick thing. You usually tell the patient, if you're addressing all of their obvious issues, exercise and control stress and eat healthy.
Wow.
And goodbye, because my 15 minutes are over. And then the next visit, it's the same thing until, you start feeling that that's not enough. So with ME/CFS, absolutely, with any chronic condition that causes widespread inflammation and widespread suffering, unless you look at the root causes, you're not going to be able to find relief. And what I mean by that is healing. Okay.
That's great.
It doesn't mean 100% cure for everybody, but healing. And healing has many different levels.
Right. And getting back on that journey.
Absolutely.
Right. Going in the right trajectory. I loved when you used the word total body burden, because I think sometimes, people, and you mentioned fatigue or exhaustion or inability to kind of regulate the body. With total body burden, does the body then have less reservoir, right?
Absolutely.
Okay. And so when you have patients that come in, or really our community, everybody that's listening right now, are there 3 things that you focus on with your patients that we could just say, I want them to be able to communicate with their physician and their practitioner. Mm-hmm. I want them to be able to be personally empowered, right? Can we distill down 3 things that they might want to, or that you think are critical to begin the journey in the right trajectory, and even to begin maybe the healing process?
Absolutely.
3 areas that you focus on.
So the one common denominator for our patients is fatigue. It's chronic fatigue. And of course, many other similar symptoms that they present with. So
I'm going to stop you just for 1 second. When you talk about fatigue, do you mean I pulled an all-nighter studying and therefore I'm tired today?
Absolutely.
But
absolutely not.
Oh, okay. So it's different. When we're talking about more like systemic fatigue, I know I asked you 3 things, but I know that there's so many people out there right now that resonate with this. So can you give me an idea of what fatigue looks like for an individual that has that diagnosis or some sort of chronic inflammation or inflammatory diagnosis?
Absolutely.
What is fatigue? What is that picture? What does that patient picture look like?
So a very distinguishing factor between ME/CFS or chronic fatigue, whether or not it's ME/CFS, but just regular fatigue, is that individuals will not find restoration of energy with common things like rest.
Okay.
Exercise is a triggering factor, and exercise could include, for some people that used to be athletes, now cannot walk fast-paced, use a treadmill. But for people who were just, maybe able to walk a few miles a day, just lead their lives as family, parents, for instance, now cannot get out of bed. So it varies between individuals, and it's a very, very debilitating condition in which they want to feel better. It's not a lack of motivation.
Right. In fact, a lot of these people that we see at INIM are highly motivated individuals. I mean, we're difficult to get in to see, right? They have to travel, all of that. So they're highly motivated, highly active individuals, and they've just been plagued by this. You said something about so there's no recovery. So it's not like I'm tired today and I can just go to bed and get a good night rest. So when they walk into a physician's office, I would imagine that can be extremely disheartening,
Absolutely.
to be told to eat a little better, rest a little more, and all is well. Okay. I love that definition.
Or you're depressed.
Yes. Yeah, that's a big one.
Yep.
Would you say that that happens a lot when people have walked in, that
they have been I don't want to use the word dismissed, but not believed. And, or maybe there's very good doctors out there who want to help, but don't have the tools, because we also get referrals from the community. And, absolutely, our patients have been through a lot in trying to heal themselves. This is not, somebody who
we're not the first
yesterday. Right. Absolutely. Some of them have been suffering for years.
Yeah.
And they just have done everything that they think and they have within their power to feel better. They have tried to exercise because they want to follow doctor's advice, and they just, they suffer from worsening fatigue. And we call this a crash episode.
A crash episode. Okay. So if anybody's dealing with this, one thing when I came to the Institute, and I just have chills thinking about it, but the consistent consensus was that we believe you, right? We believe you. We're here from you. We want you to have hope, because we've seen people just like you go through this and change their health trajectory. And we also want to give amazing suggestions or tips, either how to advocate for yourself better, how to be empowered, how to eat better, all of those things. I want to jump back to the three things that you see. So we see fatigue in our community with neuroinflammatory, whether it's Gulf War or COVID long hauler. What are two other things that you see pretty consistently with our patient base?
So fatigue, like I mentioned, neurocognitive symptoms, because those are very debilitating. Patients are
neurocognitive symptoms. Give me some ideas. Yes.
Mental fog, difficulty concentration, inability to perform at work or at school as they're used to. And I was going to say that this is probably one of the most debilitating issues that they present with, because maybe we're more resilient towards the body feeling fatigued than we are towards the mind, the brain feeling extremely fatigued, that suddenly we weren't able to just lead our lives. This is what I think mainly.
It's also nuanced, right?
It's absolutely scary when suddenly you feel you don't have the brain capacity that you used to have. It could be very, very scary, especially when obviously, like, individuals in our society, we're responsible for somebody else, like children or grandparents or, elderly parents.
Yes.
The fear that you perhaps will not be able to be there for them. I think it's horrible. And our patients suffer a lot from that.
Wow. And again, going back to the we believe you, right? That, and also I love that there's a unique way to kind of help you identify and track some of that neurocognitive response, that foggy, fatigued.
Difficulty finding words, difficulty performing tasks. It's very debilitating and it's very scary.
So far we've got, and I love the definition of fatigue. It really helps me to know that it's not able to be restored, and that exercise or activity or stress can exacerbate it. And then also now those neurocognitive, give me a third one that we're seeing individuals coming in.
We see a lot of pain, underlying pain, chronic, constant nagging pain, which can get worse. In some individuals, it's, more, severe joint pain. But in general, there's this debilitating pain, almost a feeling of having run a marathon when you haven't. Right.
And is this all because of an inflammatory response? Is it because, I guess probably multiple reasons. Right. So we see inflammation in this population.
We see metaflammation. We call it that.
Say that again?
Metaflammation.
Metaflammation. Okay, define that for me. I love that.
Horrible, widespread, unregulated, persistent inflammation that does not turn off. And the cause for inflammation is not one or two, but multiple factors. So that's when I refer to looking at the root cause, that's a very good example of trying to find root cause for inflammation. It's why it's causing this dysregulation. Why am I so inflamed? Why does the patient have so much oxidative stress that is causing all of these symptoms downstream?
So that's why they can't just take an anti-inflammatory and feel better. Take a nap and feel better.
Right.
You
Get
could
some
find
rest
some
and
feel
relief.
better.
You can go from a 10 to an 8 or
right.
7.
Do a little Sudoku and your brain is better. Right. Oh, I love this. This is good. It really helps to define this. So I'm going to shift a little bit to the future and the forefront of this aspect of medicine. We are always at INAM looking at any and every cutting edge approach. Are there some things that are exciting you in this aspect of medicine?
Absolutely. Every single thing excites me almost. So
share. Yes.
So one of the things that it's out there and it's a lot of good doctors already know it, but I came to it just from seeing my patients suffering, is a concept of chronic inflammatory response syndrome. So, I've taken a couple of courses on it, and currently I'm taking a live course with Dr. Richie Shoemaker on.
So talk to me, chronic
inflammatory response syndrome. CIRS. CIRS.
CIRS. Okay, got it.
And so it's so common to almost every single patient that suffers from ME/CFS. And the reason, again, going back to the multiple exposures throughout history and whether are these biotoxins are everywhere in the environment.
So we're talking about biotoxins.
Biotoxins, which are environmental toxins, which very commonly down here in South Florida, it's mold, the presence of mold.
Yes.
Which I'm dealing with, by the way. I just remediated my home. So it's a real thing and it happens all around us.
And it's discounted a lot of times in medicine.
We didn't know. I never learned about it in medical school unless patients were in the ICU with an obvious
aspergillus
infections, intubated and those are severely immunocompromised patients. But it is there and it's happening and it's more common than we think. And obviously not everybody that is exposed gets affected. So that's another reason why this is happening.
And that's that total body burden that you were talking about earlier.
And there's also genetic predisposition.
Got it.
And there's also some hormonal dysregulation. When I mean hormonal, I don't mean just the traditional
estrogen, progesterone.
Right. I mean hormonals from the hypothalamus, pituitary, neurotransmitter imbalance, the inability to turn off the inflammatory state.
So that's our body's adaptive capacity.
Our body innate immune system is in trouble, and therefore, it's unable to activate the adaptive immune system properly to end that inflammatory response.
You just said something that I know everybody's going to go, wait, and it's just so organic for you. I want to pull it out just a little bit. You said the body's innate immune system versus the adaptive immune system. In pencils and crayons for those of us, can you just give me a little bit of definition of what that is, just briefly? And again, pencils and crayons so I can grasp it.
Right. So the innate immune system is what the first line of defense that we have. The first line of defense. We encounter something that is foreign, that's not healthy. Our innate immune system recognizes it as a foreign antigen or particle or toxin and presents it to the rest of the immune system, who's supposed to activate an immune response, which ultimately should lead to the activation of the adaptive immune system, produce an antibody, kill the bug or eradicate, neutralize the toxin, and then eliminate that chronic inflammation because problem solved, we don't need it anymore. And then we move on.
There's an end to that story.
And that's a normal process. We all need that. If we get sick with COVID, any viral infection, but if we get sick with COVID, that's what we expect that our immune system should do so that we just, are able to neutralize infection and recover and move on with our lives. So
the exciting aspect of it is that we are starting to see recognition that the body is a dynamic, multi-dimensional being, right? That has a process that if it goes out of balance, and it can be insulted and go out of balance, we've got to do something to bring it back into balance. So that's exciting. I think the recognition, I don't know if you saw recently in the news, they call it the California Skittles law. Have you seen, they're banning one of the red dyes that's been banned in many countries. They're phasing it out. It's actually a very exciting thing because it's a known neurotoxin and a known carcinogen.
Yeah.
Right. But to have that recognition, I think is important because especially things that are marketed to kids, right? It's hard to watch the consumption of things that are going to cause damage in the body. Absolutely. Other exciting things coming down the pike or things that people should be talking about their doctors with.
those are two different things. So when I see a patient, I immediately start thinking from listening to that patient, does this person sound like they have a lot of inflammation going on? Do they sound like they may have a mitochondrial dysfunction? Because remember, mitochondrial organelles also produce energy, ATP.
So I'm going to stop just a second because you just said, how would we know if we have a lot of inflammation? Give me three things. Three things maybe to look at, even from ask for a lab, but also
before
symptom
labs, you already
perspective.
suspected by how patients feel, their
So-
inability to recover from, feeling tired, stress, pain, joint pain, swelling. They tell me, I feel like I'm inflamed. I look, and for the most part, sometimes you don't see that inflammation. It's subjective. That doesn't mean that it's not there.
Got it.
Okay. And so anything that can lead to this feeling of the sluggishness, the inability to be yourself, to feel energy flowing, in your body, points toward inflammation. I mean, I'm not even getting into, what's going on in the GI tract, because if you have a lot of symptoms, definitely that's what sets up most of the time the inflammatory cascade, just by having antigens and toxins go through the membrane and going in through our bloodstream.
Like leaky gut syndrome.
Which is intestinal hyperpermeability. Because the term leaky gut syndrome, it's frowned upon, and it's a very easy way to visualize what's going on. But it's the equivalent of intestinal hyperpermeability.
Yes.
And so
things that never should be in the bloodstream or getting into the bloodstream.
Getting into the bloodstream.
Therefore, the body sees it as dangerous, even if it's a nutrient, right?
Mm-hmm. Well, if the nutrient or whatever is going, resembles one of our receptors, for instance, thyroid receptors, and now the body is appropriately trying to neutralize that foreign antigen, but it just so happens that it looks exactly like our receptors, so our body starts attacking our own receptors. So I've seen a lot of autoimmunity.
Yes.
And I see a lot of autoimmunity in our practice. You cannot separate autoimmunity from inflammation, from its root causes. It's very important that we recognize that, yes, we can give you pills to sort of like manage the illness. But we need to look at the root causes to prevent that illness from advancing, from also leading, because once we have an autoimmune condition, we're at risk for multiple autoimmune conditions. And also in some cases, even reverse it, which is what we aim for.
But we always the target, right?
Mm-hmm.
Always the target. And it's good to have lofty goals in medicine. Mm-hmm. I mean, I love that. I'm going to give you, if you were to have a magic wand and I were to loan you my unicorn and we were going to go off and see something that's emerging in medicine come to fruition fast.
Right.
What would you like to see be accessible for clients that are dealing with chronic inflammation?
So I guess my top two would be in terms of testing, which helps us to identify root causes even more. Transcriptomics, which is genetic expression, gene expression. So we know.
So is it like epigenetics?
It's absolutely epigenetics. So we know we can have our genomic picture print from 23andMe and many multiple genetic tests. But this field of transcriptomics looks at what genes are being expressed, activated or inactivated. And what does that? What does that in our bodies, our environment? And what I mean by our environment, I mean internal and external. So it's the field of epigenetics. It can turn on some genes, turn off some other genes. And, it's a very important concept when we're dealing with multiple chronic illness with widespread unregulated inflammation. So that's one of them.
Okay, I'm going to take you to that one for 2 seconds. I've got a couple questions about it. I'm writing frantically. So in this field of medicine or this study of medicine, am I correct in saying that, we can have a genetic code, if I will, but it doesn't have to be our genetic destiny?
Absolutely.
Okay.
Absolutely.
Okay.
We have more DNA that encodes for regulatory genes than we have DNA that encodes for genes with a functional, that are going to end up in a protein and being transcribed and translated into a specific protein.
Okay. So hold on. I got to grasp that one. So you're saying we have more genes that help us be adaptive to our environment?
That regulate the rest of the
expression
genes.
of the, wow.
So, and those are very important because, certain toxins are, toxins to our DNA or toxic to our body they may result in something called hypometabolism.
Yes.
So now we're not producing, we're not transcribing the genes that we need to. We're overproducing certain proteins. We're underproducing other proteins, including proteins or, that transcription into RNA that is necessary for mitochondrial protein. And so what is a mitochondria? The mitochondrion is the organelle that produces energy. So if I don't have enough genetic material or genetic expression of those genes that are going to make up part of my mitochondria, how is my mitochondria going to function?
So when we have this emerging science, and promise me you'll come back and we'll do a podcast just on this, okay? Because I know I want to go deep in this and I'm really trying my hardest not to, because I want to geek out in a minute here. I just want to distill it down for a second. So this is an aspect of diagnostics. Can we use it as a marker to see if the therapy that we're approved?
Yes.
Okay. So the therapies that we're applying, we can go back and now look at this and see, like, I'm going to use the example of you take a cholesterol test, your total cholesterol is high, you do diet, exercise, you retest it, and you say, wow, that made a positive impact. Mm-hmm. But we can be that granular.
Yes.
Oh, that's exciting.
There's technology that looks at genetic expression. And so,
we can turn things back on, back off.
And you can see it because it comes in, reports color coded. So it's very neat. Patients can understand when they see it.
Wow.
And so it's very important because it's our ability to, like you said, epigenetics. So genetics is not our destiny. And most things I would say are encoded by different genes.
Right.
So just because you have a specific SNP, which is a small mutation, which may or may not come for a detrimental effect.
Right.
May not be like that bad. And
so
by
people that
may
can't
not
utilize folic acid, for example, or something like that. Even more.
Even way more than that. And we can regulate that inflammation, get rid of that toxin, activate the right pathways. And we're talking about inflammation, but we're also talking about aging.
Right.
At the cellular level.
Right. This is great. So it is exciting because I will say that a lot of the traditional therapies that are out there right now that are accessible, easily accessible, right? We're going to talk in a minute about lack of access, which is a big one for me and a big one for the clinic and our institute. That's why we do so much translational research, right? A lot of what's accessible to us now maybe can hopefully can mitigate a little bit of symptom profile, but it is not helping us come back into homeostasis, turn things on, turn things off, and getting us metabolically functional again.
Yes.
Okay, so that's exciting. I'm going to give me number 2 because I want us to maintain that hope. I want every single one of our viewers to know that we hold hope every day, right? For everybody out there in the universe. But we're seeing it in clinic. And so I think that bolsters the hope. It's not a false hope. This is something that we're witnessing on a daily basis. Give me something else that's exciting, emerging. Again, if we had a magic wand, we would shove it to the forefront of everybody having access to in medicine.
Right. So I would love to investigate more and to have more research into the field of peptide therapy.
Yes, it's kind of a hot topic right now, and it's something worth pondering.
Absolutely. So, I've always wondered when I see my patient in whom I'm doing everything that I can that's available to me, which is far more than I was able to do when I was when I was practicing traditional medicine, which I love, by the way. I'm an internist at heart. But when I see that patient who's doing everything he or she can, and I'm doing everything I can, and I still want to do more, and I feel we need to do something else. We need to take it to the next level. And that's when I mentioned, epigenetics and transcriptomics, but also peptide therapy.
What is peptide therapy? People are talking about it. People are asking me about it like crazy right now.
Right. So very importantly, it should be managed by a physician or a healthcare professional who is licensed to do that and who is certified in peptide therapy. So it should not be really obtained from the internet from sources that you do not know. Right. So that's not what I'm advocating for at all.
Any aspect of powerful medicine needs a powerful team, including the patient.
And it needs research, and it needs monitoring, and especially for safety issues and for purity, where are you going to get the medicine?
Right.
Because it is medicine.
Right.
So it's a small amino acids.
It's
amino acids. The definition of peptide is less than 40 amino acids.
Okay.
And they have a biological function. Okay. Whether it is tissue repair, and it depends. They all have a relatively different predominant function. However, there's a lot of overlap. So where tissue repair or mitochondrial energy function, energy regulation of the immune system, the T cells, going back to the innate immune system, to T cell function, etc. There's research into one of the gastrointestinal tract or postoperative speeding, the speed of recovery postoperatively.
So it's a type of therapy that is emerging, that we're seeing emerge.
It's been around for many years in other countries. Yes.
Sometimes we're really fast to the game and sometimes we're a little on the slow side. But I think global medicine is so important for that very reason, right? Because there's brilliant minds all over that can come together and find even better solutions than when we isolate ourselves.
But we need more research because, that's the key to everything that we do is the research to support. And so that's one of the fields that interests me, research in peptide therapy.
I know we talked a little bit about why you came to INIM personally. We've had these conversations, but some of it is the fact that we do so much translational research, meaning, we are able to take things to the patient and have available to the patient much more rapidly than most institutions that I've looked at. Is that exciting to you? Is there research that you would love to be part of?
Yes, absolutely. I would love to research MOTC, which is a mitochondrial peptide.
Nice.
And, so we've been trying. We've been trying for a while.
It's just money and time. Just money and time.
We have to go through the process.
Absolutely.
And make it possible for our patients.
Well, that's great. So it's very exciting. And this leads me into kind of our next thought here. There's accessibility issues, right? There is such diversity in the access to care across the United States, and the quality of care. It's kind of shocking to me. We get to be in an amazing facility, an incredible collaboration of practitioners. How can someone that's out there have more accessibility to a whole body approach, whether it's integrated functional or just a clinic or a physician that believes them? Like, what would you say to the person out there that is feeling a little bit hopeless right now in getting good care?
So it's very important for patients, let's say you're planning your visit to your traditional doctor, you only have 15, 20 minutes at most, to have your priorities, know that the visit, they cannot, unfortunately, give you more time, as much as I would like to. So if they're limited to 15 or 20 minutes because of the nature of the healthcare system today in America, so what is the most important, point that you want to bring up to that doctor who's seeing you?
So really talk about the maybe categorize the symptoms that you're feeling, maybe your health history, be really organized before you walk in. We have this sheet that we always call a request for care, right? And it is that. It's what are you feeling? What is your family history? And I know that everybody fills out those forms, but I think being able to almost have an elevator pitch for what's going on in your body, but also, do you advocate having a clear desire for outcome before they walk in?
Yes, and you also have to advocate for yourself, right?
Yes.
Everybody should always advocate for themselves. And the most important thing that comes with establishing rapport, do you feel that the doctor in front of you, it's a person you can get to grow a relationship with and trust? Because there will not be nobody is able to solve all of your problems in one day. Actually, I don't think anybody is able to solve anybody else's problem. There's had to be a teamwork, and there has to be a relationship. So yes, if you unfortunately only have access to 15, 20 minutes with a practitioner, just make sure that it's somebody that you will feel welcome and that you will want to see perhaps more often. So maybe you can see on a monthly basis and, 20 minutes at a time. That adds up to a lot. And there are also resources. You can tell a doctor is really interested when they're thinking outside the box and offering things that they do have some knowledge about and access to, which is recommending lifestyle changes, but not just a traditional eat healthy, exercise, come back.
Right.
Just specifics, maybe a referral to a nutrition, and maybe a pamphlet, which just some dietary information there, how to eat healthy.
You just gave everybody out there permission to feel welcome by their physician. And I'm not sure if physicians always understand the impact of having that permission as a person that seeks healthcare, right? I think that sometimes we don't want to be a burden to our physician. I think sometimes we don't want to take up too much of their time. We don't want to complain, especially women, right? We don't want to feel judged as being maybe hysterical or hypochondriacal or anything of that nature. So I think giving people just the permission to feel like you can create a relationship with your practitioner and that you have a right to feel welcome.
Absolutely. Right. And, you have to feel that chemistry flow because a lot of times that person sitting in front of you, which is also another person.
Yeah.
That doctor is another person who has a lobby full of other patients that have the same needs as you do, but they have a boss or a system that is putting pressure on them to just see you with 15 minutes time. So look at the big picture. Is this somebody that I can establish a relationship with that I can trust?
I love that.
And then can I come back?
Right.
As many
and do you
times
have a desire to come back? Right.
Absolutely.
I mean, I have people that tell me all the time, I hate going to the doctor. And I go, then why are you going there? You want to have a positive experience. It's a difficult situation to seek or ask for help.
And don't be a pill seeker. That's very important. Be willing to do the work. Because at the end of the day, you're your healer. We're just instruments. We can give you some information. We can do testing. We can give you medical recommendations, but you're the one who's going to do the work.
That's amazing. Mm-hmm. Yeah. Okay. So if they are going to do the work, I love that you said that. If they're going to do the work, can you give us some parting tips? Like if you're struggling with this, if you're having a difficult time regulating inflammation, if you're dealing with chronic inflammation, I loved the term that you used, meta-inflammation. Mm-hmm. What are some things, some really simple things that everybody out there can start to kind of incorporate in their wellness plan?
So nutrition would be for me, nutrition and rest and managing stress.
Okay.
Those three are patient controlled.
I'm very biased when it comes to nutrition. And so we didn't plan this, I promise, but I love that you put it up at the top. Nutrition, rest, and managing stress. I think if we can just say that those are absolutes, like I say brushing my teeth is an absolute every day, right? But focusing on whole foods, focusing on rest. So do you have a particular recommendation? Is it 8 hours? Is it as much as you need?
In general, well, especially for our patients, as much as they need.
Okay.
But at least 8 hours. And it's not 8 hours any time of day. Like I had a patient recently tell me, I thought it was just as long as she slept 8 hours, I could go to bed at 2 or 3 in the morning.
Oh my goodness.
It's to just follow our naturally innate circadian rhythm, which comes from the production of growth hormone when we first go to sleep and melatonin. And so, yes, anytime around 9 to 10 p.m., it should be our, time to fall asleep. And then for patients who feel fatigued, if you do need to, don't push. Please do not push. Rest. If you can take breaks during the day, short nap, multiple 10, 15-minute naps, or a 2-hour nap during the day. We try to keep those before 3 p.m. so that it doesn't affect our circadian rhythm at night.
I like that tip. Try to make sure your naps are done by 3 p.m. I used to do that when my kids were little. I would make sure that last nap when they were itty bitties and still taking 2, I would always make sure they were. Yeah, that's great.
Make sure that their circadian rhythm stays in tune.
If I think about that, think about what's happening in our youth. We're growing. We're creating new cells.
And we need more than 8 hours at that time.
Right.
Absolutely.
Right. So if you're healing from something major and complex, that would be. I'm sorry. I'm writing that in pen. Stress. Let's talk about stress for a minute. Identifying and eliminating things that are potential stressors that we do have control over is a great one.
That we do have control over, absolutely.
Right.
We don't have a control over all the things that cause stress.
Exactly. So are there a couple tips that you tell your patients for stress management?
So it's about management, right? It's not about eliminating stress. That's the wrong message. I wish I could eliminate traffic, right? Could we get rid of traffic? Eliminate the word that we're all so stressed about, unfortunately, these times. But it's what we do with our stress. We know we have stress. Stress is necessary. Cortisol is necessary. Our stress, response is necessary for survival. But like the same thing with chronic inflammation, chronic stress, elevated levels of stress. They shrink our hippocampus, which is a part of the brain.
Yes.
So yes, we need to try it as much as we can. For some people, it could be meditating for 2 hours. That's great. I've done it. Meditated maybe one time. I think it was 4 hours one time. But yes.
Can we like save it? Like we, like savings account. I'm going to meditate 4 hours. It's going to last me 2 months.
And that was for a specific intention, but anything as short as 3 minutes.
3 minutes.
And if you can't, because, there's active meditation. So if you think you're going to keep your mind quiet, impossible. The mind is a monkey. It will keep jumping around. Just let it be. But anyway, if that's not your style, there's active meditation. There's some forms of yoga that practice active meditation. So you're chanting, if that's still not your thing, contemplation. That's the first form of meditation that I learned, back when I was a teenager. And I didn't know that I was meditating unconsciously, but I was contemplating nature. Super healing.
That's
absolutely
wonderful.
Walking barefoot.
Everybody has
beautiful
3 minutes of homework. I mean, that's attainable, right?
And that is attainable.
If I were to say 3 minutes and I was either going to earthing, go walk, hug a tree, squeeze my puppy, pet my horse, deep breathe, have a nice warm cup of tea, hug your loved ones.
Kids are, when they're behaving, they can be very, because they
lock yourself in the bathroom.
Endorphins of, this hormones
Absolutely. So if we took 3 minutes on the hour every hour, would that make a good impact?
If we think, that would be amazing. I understand some people can't,
right.
Okay? Try to be somebody on the run, a teacher who's,
Right.
But something. And that's what I tell my patients. These are tools. What tools work for you? Which ones can you implement? And maybe you come up with a new one and you tell me. But one that I loved driving in this horrible traffic, listening to mantra.
Ooh.
Absolutely. I mean, you're listening to the radio while you're driving. So I would just YouTube a specific intention I had.
I love it.
And find a mantra for that specific intention.
A mantra or an affirmation.
Yes.
Yeah.
And you can
wonderful.
listen to that. Absolutely. There's nothing, and you're meditating. You're in a light meditative state when you're listening to mantra.
Absolutely. That's amazing. Dr. Fornos, you always give us just tips that we can actually realize good health with. And I appreciate that. It's why people love your podcast and your interviews. And it's just amazing to have you here with us today. You have to promise me I want a podcast just on peptides, just on epigenetics. And then I know we're going to have lots of questions from our listeners. And so please come back.
Okay.
Okay, great.
Thank you so much.
Absolutely. Thank you so much. It's always a pleasure and an honor to speak with you. And I appreciate it.
Same to you.
Talk to you soon.
Okay.